Hi, everybody, and welcome to the Models of Healthcare lecture. So in gerontology, although we know who we're working with and what it is that we would likely be doing, it is important to understand what part of the healthcare system our role takes place as possible gerontologists or activation for gerontology. So where do we see our role in gerontology? So today we're going to look at we're going to talk about the three models of healthcare, and within those three models of healthcare, we'll see a connection to the types of facilities that our older adults live in. Now, it is important that I don't care for that F word. Facilities does make it sound very institutionalized and not necessarily a home like environment. So just to be clear, we're using the term facilities and the term institutional today to illustrate the different types of areas that people can be living in. But as we progress into the activation for gerontology, you would see that we would start to eliminate certain words like that so that it could be more representative of an older adult's home and not necessarily a facility or an institute in which they're living in. And then we are going to touch briefly on the health promotion model, but that is actually a whole other lecture, so we're actually going to just touch on it briefly here. So, three models of healthcare. So first of all, a model is actually helps us to describe a complex system. So it is where we have, again, it's like those theories. It's that basic structure that starts us off, right? So every area of healthcare has a basic structure where it starts, and then it can grow from there. So the three models of healthcare are the medical model, the social model, and the health promotion model. And that's specific to Canada. There are other countries that follow similar models, but every healthcare system is different than ours. And so it is important to recognize that. So firstly, the medical model is exactly what it sounds like. It focuses on the medical aspects of the individual. So the medical model ideally looks at treatment of a disease or an injury. So it sounds exactly as it would. An example would be going and seeing your doctor, right? So you go to see your doctor, they get a medical history of you, they'll maybe do an examination and send you for an X-ray or some sort of a diagnostic testing. So the medical model really just focuses on the physical, the physiological, those biological aspects of disease and condition and of the human, right? So we see the medical model take place in hospitals and in certain clinics and in a physician's office. Okay, so the medical model, again, is a basic structure of where the medical system and our healthcare system can then grow from. The social model is where we would see ourselves. This is where we're going to see individuals like ourselves, either as gerontologists or activation for gerontology, or anyone who's in that sociology role. The social model offers more aspects than the medical model. So it understands the medical care of someone and recognizes that it is an important aspect of the healthcare system. So the social model does not just completely exclude the medical aspects of the individual. It understands it's a very complex system and that the medical care is just one part of it. So this model looks at more than just the physical and biological needs of the individual. It will look at some of the personal and family issues and dynamics. For example, if we're talking specifically about the older population, the social model will look at what kind of home care the individual would need. Do they need help during the day? What kind of family dynamic do they have at home? So the medical professionals are still very active within the social model, and the medical model is very much a portion of this. However, the social model extends further to better understand the whole individual, right? So some of the medical professionals that we would see within the social model are such as like physiotherapists, counselors, and social workers. So those who are active in the medical model, but at the same time, an extension, so to receive further rehabilitation or care. So an example of a facility or an institution within the social model would be long-term care. So long-term care is not just a facility, but rather a type of care. It is for, we hear that word long-term care when we're referring to long-term care homes or nursing homes within Ontario. But long-term care is an example of how the social model and the medical model work together to care for someone. So an example within the social model is long-term care. Long-term care not only provides that medical aspect and that nursing care, but it combines it with social services and community activities and resources. So it combines the two. So for example, if we wanted to look at long-term care in the terms of a nursing home is somewhere that someone lives and they also receive social and community programming while receiving medical assistance. So our focus today is actually going to be on that social model. We generally look at the social model because we are, as activation for gerontology or any gerontologist, we're generally working within the long-term care realm. So long-term care generally serves people with chronic illnesses and functional disabilities. So long-term care could be for anyone who has had an illness that is causing them to not be able to physically or cognitively participate in society independently, right? So again, it combines those medical services with the social and community services. So within the social model, we can see that it helps families to cope with the demands of the disability. So for example, long-term care helps individuals whose family member maybe has a cognitive or physical impairment. It allows them to then receive assistance and help and from the long-term care system to take care of that individual. And it comes in different forms, right? So the term long-term care is used synonymously with nursing homes here in Ontario, but the term long-term care generally could include other ways of assisting the individual. For example, long-term care can take place in someone's home. It doesn't have to be in a nursing home. It generally takes place in a nursing home, and it can also take place within the community. So I'm going to post this video up here in the discussion board and allow you guys to go in and ask yourself this question and respond in the discussion board. It is just a quick video on what is long-term care. And then if you can just have a interaction with your peers in the discussion board about what are some of those benefits of long-term care. Here is a chart where we're going to compare both the social model and the medical model. So the medical model generally views the older adult as a patient, someone who's there for an acute reason. This generally occurs within hospitals, and the physician would focus on a medical assessment, a diagnostic assessment, and then hopefully at that point find some form of a cure or prescription to solve the problem. Within the social model, we would see that individual now more so as a consumer, someone who's maybe paying for our service, or even a resident, someone who is living within our home, or we're living within a home that we are a part of. They're generally dealing with more chronic illnesses. So things that they're dealing with for a long time, and it might be getting progressively worse. The social model is more so seen within the community and within homes. So we're seeing it in nursing homes. We're seeing it again within home care. One of the main areas here is actually the maintaining the functional capacity. So that's the difference between the social model and the medical model. Is the social model really does focus on maintaining someone's ability to function, maintaining their independence. So it's not necessarily that there's a cure for whatever is the ailment, but rather how can we allow this person to continue to have a quality of life that allows them to be somewhat independent or at least functional within their environment. So the social model would look at it more of a multi-dimensional assessment. It's not just the medical assessment, not just those biological aspects, but rather multi-dimensional, meaning that they're going to look at the social aspects, the environmental aspects, the emotional aspects, the spiritual aspects, the cognitive aspects, and the physical aspects of the individual. So the social model would focus on getting those clients to meet their own needs. Again, that goes back to the functional capacity, right? So maintaining functional abilities. In the social model, we see that the power is shared. We want to maintain autonomy and independence for the individual and allow them to continue to make choices, whereas the medical model might have some form of a hierarchy in the sense that the physician generally has more knowledge and is able to prescribe certain things, and the patient would allow that to occur. So between the medical model and the social model, there's a lot of similarities, but it's really just about finding the differences and understanding how the social model can provide a more holistic and multi-dimensional view of the individual. So within the social model, though, there's different types of facilities. So the types of facilities that are generally associated with the social model are things like long-term care. Like I said, it's a term as well as a facility. So here in Ontario, we refer to long-term cares as we refer to nursing homes as long-term care homes or long-term care facilities. There's such things as geriatric day hospitals, adult day centers, and assisted living and home care. So we're actually going to look at all of those in more detail. So long-term care. Long-term care, and I've already said this several times, but long-term care is also known as nursing homes. So nursing homes was more of an archaic way of referring to it, but for the fact that we're just learning about these right now together, we can continue to refer to them as nursing homes, and we will learn that the vernacular is actually to refer to them as long-term care. So long-term care, if I were to give you an example, if you've never heard of a long-term care facility before, is a retirement home where individuals who are unable to take care of themselves anymore would live. Long-term care generally is not overly filled with individuals who are still very active within their community. It tends to have a higher ratio of individuals with dementia. Long-term care is an area where we see a lot of physical and cognitive impairments that have limited an individual's independence quite significantly. So we often see those over the age of 85 in long-term care. It's a little different than retirement in the sense that a retirement home might be a more active, younger group of older adults. So each province has its own system for long-term care. So we're just going to focus on Ontario specifically, but they're all quite similar. And generally those who are in long-term care are older, like I said, 85 or older, usually have poor health, usually have some form of a cognitive impairment. One of the major indicators of a long-term care placement is actually a recent fall or an emergency room visit. Individuals who are older and have had a recent fall that hospitalizes them for quite some time, or an emergency room visit that led to another ailment, can impair someone so severely that they're unable to go home again. So they go from a hospital setting to a rehab setting to a long-term care setting. Other indicators of a long-term care placement are severe incontinence, poor social relationships, and little involvement in activities. Now, the last two, poor social relationships and little involvement in activity, are important to note because they are indicators because they might lack the support system that is necessary to successfully age. So if you don't have a strong support system or someone or a group of individuals who are willing to care for you as you age, you might find it difficult to stay independent. And so we're going to talk about that also a little bit more in our course, and the importance of social supports. So some individuals believe that a long-term care home or a nursing home are somewhat like institutions, and that they take away the independence of the individual, and they tend to have a bad reputation for that. Of course, we're seeing some really positive long-term care homes that are really promoting quality of life, independence, choice, and autonomy in our older adults. However, that's not necessarily the thought process from a lot of people. So here's where I would have asked you at this point to think about some of the pros and cons specifically for you and your family, and what you would feel if your family member or yourself was placed into a long-term care facility, right? So what are some of the pros and cons? So say you do have a physical ailment or a cognitive impairment that doesn't allow you to live at home safely anymore, and you had to go. So you would have one-to-one care, meaning have someone who is able to help you to use the bathroom, get dressed, take a shower, eat your food, get from point A to point B. So having someone to do that for you. Another pro could possibly be the safety aspect. So we could have included safety here, right? So safety is of that feeling of not being fearful of falling in your home, or your family fearing that their loved one might open their door in the middle of winter and walk outside without a coat on and not remember where they lived. Now, some of the cons of moving into a long-term care facility, the obvious one is missing your family. So having this new area, this new environment to live in, and not being with your close family. You might fit, a lot of people also feel that their independence is taken away. So take some time after you've read through the pages in the textbook and identify what some of the pros and cons for long-term care are for you and your family. So what we're seeing now as a move away from the typical long-term care nursing home models is that we're seeing some more improved community care programs as well. So we want to provide, and I say we, but our whole system wants to be able to provide more options for the individuals where they can provide care or to feel safe and independent within their homes or within their own community. So there's other forms of long-term care that we can offer. So one of the community programs that are available for people who are possibly physically impaired or cognitively impaired but still living at home is a geriatric day hospital, which could offer a full range of hospital services. And again, this is for people living within the community. And ideally, they'll assess their needs, the individual's needs, and plan some form of a rehabilitation or some form of a care program. So they can still continue to live in the community, receive the same care based on their needs. Again, this is saying that they are still independent enough to be able to live in the community or have enough social supports to support them in their community. Okay, so this is really just possibly, if we took the right steps, this could help to maintain their independence. I didn't say improve, but rather maintain. So if they have a level of independence where they're able to live on their own with minimal social supports, then we want to maintain that and keep it at that level. There's no necessity to necessarily improve it, but rather just keeping it at that same level. And so the types of services that would be available are physiotherapists, speech therapists, dietitians, pharmacists, and occupational therapists. The next program that is available within our community is an adult day program. And the Adult Day program is a great program and allows for older adults who are living within the community, likely living with their family, being cared for by, say, their adult children, living within their home, but they get the opportunity to attend a day program that not only benefits themselves, but also benefits their family. So those in the Adult Day program, generally it's for safety reasons, where they're unable to possibly stay in their own home throughout the day while their family is at work. So it's an adult program that has simulation activities and recreation and social opportunities to keep them engaged throughout the day while, say, their family is at work. Now, again, it's not just a place for individuals to go just because their family is working. Even if their family isn't working, it could be still a place that provides them with the social recreation, stimulation that they might not get at home, right? So especially for those with a cognitive impairment. So it really gives them that opportunity to socialize with people like themselves and keep them engaged. So there is some medical services in the sense of having possibly a PSW on staff, a personal support worker, someone who can help them to use the toilet or to eat if they need help with that, or to get from one chair to another chair. But really and truly, it is more of a focus on recreation. So recreation is the big deal here. It's that social activities and recreation opportunities that they get to do throughout the day. Adult day programs generally run from Monday to Friday, 9 to 5, typical work hours, because it does really assist those who are caring for their parents and are unable to care for them throughout the day while they might be at their own jobs. I have another video here I'll get you to watch outside of the lecture, and if again, it's just like a little 2-3 minute video on what an adult day program might look like, because you can sit and listen to me, but a visual opportunity is much better. And then we have assisted living. Assisted living is between living at home and long-term care. It's similar to living in a very independent setting like a retirement home, but being staffed 24 hours in case of an emergency or in case of a need. So assisted living, an example that I have was I worked in a retirement home when I was a teenager, and they had a floor that was considered assisted living, and it was safe in the sense that the elevator didn't stop there, so it maintained their safety by keeping them secure. They had added PSWs and added nursing staff to that particular floor so that they could provide them with medications and assistance in ambulation or assistance in any of their activities of daily living. But they still lived within the independent retirement setting. So assisted living could occur also in these there's some apartment buildings. An example, my grandmother lived in one where she was fully independent, but they had staff on site that would pop in and check that she was okay, help her to get her medication, and to make sure she was eating. So assisted living is a little bit of a vague statement, but generally what it does is it's offering assistance to those wanting to continue to still live in an independent setting, like a retirement home or an apartment type dwelling. So generally, they might offer help with activities of daily living. So if we haven't defined that yet, activities of daily living are those self-care activities that we all do every single day and sometimes we take for granted. And they are things like using the toilet, grooming ourselves, such as brushing our teeth and brushing our hair, having a shower, going in the bath, walking, eating by ourselves, and dressing. So these activities of daily living is what maintains our independence. When we start to need help with those things, that's when we now have lost a level of our independence and we need assisted living. Now, home care is exactly how it sounds, similar to the medical model. Sometimes the definitions are exactly as the title. So home care is receiving care in our homes. So this is generally individuals who, again, home care could be in different settings. So you could be living completely independently on your own. Like my grandma at one point before she went to a long-term care home, she received care within her home. So she had people who would come in and help her with her bath instead of her doing that on her own. Even though she was very independent, it was just that fear of falling. So we maintained assistance with that. And they would also just check to make sure that she was eating her food and not forgetting to do certain tasks. So home care can occur like that. It can also occur for people who are living with their adult children or extended family and they receive home care. So it's just that care that's happening within your home. And it could be from personal care such as showering, bathing, eating, dressing, grooming, to something that's just as simple as checking in by delivering meals. So home care is also that part of just making sure that meals are delivered. I know that for my grandmother, she just got to a point where cooking was hard because standing for a long period of time was difficult. And so she had her meals delivered. She did not have a cognitive or a physical impairment. It just became a difficult task for her. So this home care blends that medical and non-medical services. It just really helps people to stay in their homes longer. So then moving on, this is our third model. So we talked very briefly about the medical model, a chunk of time on the social model and the types of facilities to illustrate that social model, and now the health promotion model. The health promotion model we can see in another lecture, so we're only going to touch on this briefly here as well because it is a great lecture. Health promotion is an area that a lot of my students like to get into because it really is about advocacy and creating something that could be preventative of some diseases. So it is a really great area to work in. So the health promotion model is where we focus on prevention and self-care. So instead of curing a disease or prescribing something for a disease, we're focusing on not getting that disease, right? So we're preventing, we're promoting health. So the way that we would promote health for the older population is to promote that they have a lifestyle change. It's never too late to start exercising. It's never too late to start eating healthy. It's never too late to stimulate your brain. So the health promotion model is something that can be used from birth till our later years, where we are just hoping to promote self-care, right? And so the way we do that is actually through knowledge, increasing the knowledge to individuals. So telling people, hey, this is one way you can prevent that disease. This is one way you can prevent dementia. This is one way to live a healthy life, right? So we increase people's knowledge about something and then we are promoting healthy behaviors. So healthy behaviors and environmental improvements are general focuses of the health promotion model. So when it comes to health promotion model, the types of programs that we can promote, and this is just a very short list. This is where you get to be creative in if this is an area you want to work in, because you can come up with your own areas of health promotion to eliminate a disease or to eliminate those having to go to long-term care. Is we have, ultimately promoting fitness, or at least promoting that older adults at least start to be physically active, doing anything physical from stretching to walking to doing anything more than that. Promoting appropriate nutrition. So as we age, we all know that we need to be more active and eat healthier, right? So just making sure that we continue to do that. The three big health promotion programs that we see are falls prevention, elder abuse awareness, and aging at home awareness. So in health promotion, and this is why it's such a long lecture, so we're only touching on it here, and I'm going to film another lecture for you specifically to health promotion, is because the these three are they're very detailed. So in health promotion, to eliminate having an emergency room visit or to eliminate having to go into long-term care, we try to promote or at least prevent older adults from falling. And how do we do that? We would do that through promoting physical fitness, or just promoting a better understanding of our environmental surroundings. Another program is the stopping of elder abuse and the fact that that is something that occurs within our society. So making people aware of that so that we can prevent that. And then also making people aware of the concept of aging at home. As simple as it sounds, aging at home or aging in place is difficult to do if we're not prepared. So those three programs are big programs in health promotion, and we're going to talk about those in more detail in another lecture. But as for that, today we are going to end there with health promotion as our third model of healthcare, and we will see you in another lecture on health promotion. So thank you so much, and I will see you guys in another lecture. Have a great day.